Coming up, we'll be on location at the Julian Center for Comprehensive Dentistry in Columbia, Maryland, discussing the benefits of holistic dentistry and how they can improve your dental health and improve your smile without the dangers of mercury, amalgam fillings, fluoride, toxic root canals, and gum disease with one of this region's top dentists, Dr. Gene Sambataro, otherwise known as Dr. Sam. Dr. Sam received his DDS degree from the University of Maryland School of Dentistry and is widely recognized as one of this region's leading dentists. Welcome, Dr. Sam. It's a pleasure having you on our program again.
Thank you. Thank you for inviting me back.
We've got a lot more to talk about today. We have another patient that we're going to hear from a bit later of yours as well. But I wanted to ask you, because your practice focuses on providing holistic dental care, and I wanted you to begin, if you may please, by telling us what holistic dentistry is.
Yeah, it's a term that most people aren't aware in the dental field. People have heard of holistic medicine.
Yes.
Tend to think of sometimes a more natural way to help patients, but also sometimes a little mystical. Well, in holistic dentistry, there's nothing mystical about it.
Yeah.
It's treating the whole body, understanding the basic tenet that the mouth is connected to the rest of the body. Somewhere we went wrong.
Yeah.
And we started addressing oral issues and mouth issues and teeth issues as if they weren't connected to the rest of the body. So when we look at oral disease or oral pathology or whatever's going on in the mouth, we want to understand the impact that it's having on the rest of the body, and we want to understand what the impact of the body systems are having on the mouth.
That's a great point, Dr. Sam, because a lot of us don't realize, a lot of people don't realize that, as you just said, that the mouth actually is a gateway to the whole body.
Yes.
And if there's issues in the mouth, many times there are going to be issues in other parts of our body, including some serious potential issues can result as well.
Well, there's no doubt about, and the evidence is here now, even though we've been practicing that way for over 30 years,
Yeah.
that the mouth is truly, as you said, a window.
Yes.
So if we see, for example, bleeding gums, is it because the person's not brushing and flossing? Possibly. That's obviously a good thing to do. Is it the fact that they're not using the right toothpaste or the right toothbrush or the right mouthwash? Probably not. That's what the media wants us to think, because they want to sell their product.
That's right.
What if they have a vitamin deficiency? What if they have some other systemic issue that's leading to the production of certain bacteria, which we call the biome or microbiome? That word is becoming very familiar. That's altering the environment in the mouth. That's making us susceptible to our gums being puffy and bleeding and losing bone. And as you mentioned, if it's happening in the mouth, which we can see visually, what's happening in the rest of the body?
That's right.
That we don't have a clear view of, that we need multiple tests to figure that out. So that's kind of our approach, is we want to look at oral health and how it impacts the rest of the body, and then looking at the oral health, is there some other contributing factor that might be leading to the reason why certain oral issues won't resolve? Why does someone have residual gum disease? Why are they getting cavities over and over again? Are they not brushing? I mean, my patients say, you know, I brush 3-4 times. I brush more than anybody else, and I still get cavities.
Yes.
There's another issue. We'll talk about that in our interview here.
Absolutely.
I'm sure.
So that's really what it means to be a holistic dentist, as you just
looking at
touched
the
on.
big picture.
Yes.
Absolutely.
Now, I also wanted to ask you what additional training is necessary to be considered a, quote, holistic dentist?
Well, it's all over the place. So there's several organizations. One of them is called the IAOMT, the International Academy of Oral Medicine and Toxicology.
Okay.
Gives you a great global understanding of mercury toxicity, fluoride toxicity, and how to be a more comprehensive dentist in terms of looking at whole body health.
Yes.
There's the Holistic Dental Association. Same thing, looking at whole body health. How does the interaction between the rest of the body and the mouth occur? And then the IABDM, International Academy of Biological Dentistry and Medicine. That's a mouthful.
Yes.
So those are the three major organizations that if you take their courses, go to their conferences, you're going to get a better understanding. And then there's other speakers out there.
Yeah.
We say that we learn more once we get out of school than we did in school. So graduating from dental school gave me the right and license to practice.
Yes.
But most of the learning occurs after that. So it depends on what direction you go. So with that in mind, your next question might be, how did I get there?
Yes. Speaking of that, how did you?
Yeah, well, I came out of a very good school, the University of Maryland. I then did a hospital residency at University Hospital in Baltimore. And then I went in practicing traditional dentistry. About 5 or 6 years into that, I unfortunately had a friend who was diagnosed with stage 4 melanoma. And the consequence of that was they told him he had 3 to 4 months to live. Another paisan, as he was, strong head.
Yes.
I'm not going to die. I'm going to beat this thing.
Yes.
And by the way, that was 1986. He's still alive today.
Oh my goodness.
So
3 to 4 months became 30 plus years and still
yes,
going.
Still going strong. So my friend went to a alternative clinic in California, and as I said, he's alive today, 30 plus years later. And when he came back, he said, you really need to pay attention to this, is that the first thing they asked me when I walked in the clinic is, open your mouth. They looked in his mouth, they saw these mercury amalgam fillings, they said, we have to get those removed first before we do any treatment. We don't feel like the therapy and the treatment that we're going to do is going to be successful if you still have those fillings. I was taken back. I was like, what are you talking about? Mercury is safe. I was told that in school.
That was the standard, right? Everyone had them back then.
Yeah. So we don't have enough time to go into all the background of that.
Yes,
But
yes.
so I was able to find some literature. It was a book called It's All in Your Head. I read that from cover to cover. I still remember I was on an airplane sitting next to my wife and I said, I think we need to change our practice. I think we're placing these amalgams in patients that could be harmful to them. At best, let's opt to not do this anymore in favor of our patients' health. So that was kind of the path that led me into that holistic perspective. So
you really are a pioneer then in this area because now holistic, alternative, looking at a person as a whole has become very popular in wellness, right? In holistic medicine. And here you were you're talking many years ago.
it was a long time ago.
Yes,
So
basically already through that experience with your friend and seeing the results that really opened your eyes to look at even your dental practice and your patients, which at that time people just looked at them as from a dental perspective, right, in the mouth related area.
Right.
And here you started looking at each of your patients as a whole, and how the mouth is tied to the rest of the body and how one area and a problem in that area in the mouth can affect the person as a whole. So that really makes you a pioneer, Dr. Sam.
Well, once I learned that information, I really couldn't turn away from that and just ignore it, because I'm a health provider. So I'm thinking, what's in the best interest of my patients?
Yes.
And I'm of the age when, as a child, we would used to play with mercury, when we would break a thermometer and we'd roll the mercury around. So no one thought of that as being an issue. Now, and today, currently, if you break a thermometer, you have to call the hazmat.
That's right. You're right.
Come in and clean out your whole house.
And back then we'd play with it, literally.
Yeah. So if that's true, why in the world would we be placing something like that into the patient's mouth?
That's right.
So it made more sense. And we tend to ignore the fact that the composition of what's called an amalgam or silver filling should actually be called a mercury filling. Simply because 50% of the composition of the filling is mercury. The other 50% is silver, copper, tin, and zinc. Why do we call them silver fillings? Sounds better.
Yes, then
right?
it does mercury fillings.
Yes.
That's right.
If we said we're going to put an arsenic filling in your mouth, you probably wouldn't be too open to that.
That's
and
right.
nowadays, if you said mercury filling, you also would probably be opposed to that.
That's right.
So the controversy was, okay, there is mercury. We know mercury is an issue. We know it's a toxic substance. So the claim is the amount is so small, it's not going to have an effect on the patient. We don't know that. We know for a fact that 10% of the population has a true allergy to mercury. But what about the other 90% that might have a toxic reaction to it? Not all of them, but a certain percentage of them. We don't know who they are.
That's right.
So why not err on the favor of the patient? So at that point, we stopped placing mercury fillings.
Good for you.
We started looking at other alternatives. Now, some might argue, well, what are the better alternatives? Well, in that day, the best thing was composites. And some will argue, well, composites aren't as strong. Composites tend to leak. They're plastic. So we started looking at better and better materials. So going forward 30 years, now we have ceramics.
That's right.
And the ceramics are far better. They're biocompatible.
Yes.
They're aesthetic, and they're extremely hard, so they're durable. So you can't argue now that there's not a better product, because there absolutely is. We can restore people's teeth to better than what they had before.
That's right. And with a natural look. That's
Natural
also
look,
important.
Healthier,
Yep.
biocompatible, and so we don't have to really place these old technology. I mean, this is technology that was brought to the United States in the 1840s.
My goodness.
So I don't know about you, but I'm not using any technology from the 1840s.
No, not in this day and age,
Yeah.
right?
I mean, I grew up when they had dial phones.
That's
I don't
right.
have one of those in my house. In fact, I don't have a phone in my house.
That's right. There you go. Everyone uses their cell phones
Yes,
now.
yes.
So holistic dentistry is different than general dentistry in the sense that, as you just touched on and elaborated as well, it really looks at each of your patients and each person as a whole.
Yes.
And how the mouth and the rest of the body really are all tied together, as opposed to dentistry many years ago where it just looked at the mouth literally as separate from the rest of the body.
Yeah. And it's really a philosophy.
Yes.
The treatment regimens are not really different, other than we use different technology now, so we don't always use a drill. We will sometimes use lasers. So that's technology that's available to every dentist, whether you're holistic or not.
Yes.
So it's not anything mystical or magical. It's really a philosophical. And we kind of say here that we're East meets West.
Yes.
Eastern philosophy of whole body health, looking at things like you said, mindfulness, looking at everything that's going to help the body. But then the Western part, using technology like lasers,
Yes.
digital x-rays, which have less radiation. All these things are in favor of the patient's health, but also providing a diagnostic quality that's far better than anything we could have done years ago.
Absolutely. And actually, the first time we had you on, Dr. Sam, you were talking about advancements and treatment options to help people who suffer from the sleep apnea disorder, and how prevalent that issue is and how dangerous it can be as well. And you really touched on in that interview, and for all of you watching, you should definitely see that interview as well, because it was very informative, and it kind of tied in a little bit about what we're talking about here today, in the sense that you said in that interview, and I remember very clearly, that issues that we have related to the sleep disorders, the sleep apnea, really affect other parts of our health and our body in ways that we don't even realize they're affecting by not getting much sleep, right?
Absolutely. And Rocco, you're paying attention.
Yes, and here we are, fast forwarding to this interview, you know, the mouth connected to the rest of the body. People, your approach is to look at each patient as a whole, and to customize a plan to help that patient continue or achieve good health overall, not just related to the mouth area.
Well, and you put that so eloquently that I couldn't said it better myself. But yes, looking at not separate parts. If someone has a TMJ problem,
Yes.
if they have mercury in their mouth, if they have gum disease, if they have a sleep apnea issue, we have to look at the whole picture.
That's right.
What's contributing to that? Why does someone have TMJ problem? Maybe because they're grinding their teeth. Why are they grinding their teeth? Maybe because they're not sleeping.
That's right.
Maybe there's an airway issue. We also know mercury, as it evaporates, can affect the nervous system. Could that be causing us to clench our jaws? Very good possibility.
That's
so
right.
we have to look at everything. And probably something that's quite overlooked in most dental offices is what's the effect of diet and nutrition. Okay, because that important issue we can't ignore.
That's right.
Because it's not about necessarily, and don't get me wrong, I'm not saying don't brush and floss. You should. Your listeners need to brush and floss. Let's look at your diet. Let's look at your nutrition. So as we talked in our previous interview about lack of growth and development is related to poor nutrition, not breastfeeding, not getting the right foods early on, so we don't get the growth and development.
That's right.
Why do teeth break down? Because we don't get the right nutrients. You know, our food is so depleted this day. So you might have to take certain supplements. And some of the things that we recommend that we really stress to our patients, and we have available where they can get them on their own, vitamin D3, vitamin K2, calcium and magnesium. They need these things for healthy bones and healthy teeth. So good digestion. Maybe they need probiotics.
Yes.
Maybe their microbiome. We talked about that's the environment of the bacteria. Remember, there's more bacteria than there are cells in the body. So we want to support the good bacteria. That creates a healthy mouth. So it's not just about fixing things. So if you came to me with a broken tooth, okay, I'm going to fix it. Okay, I'm not going to go into a long philosophy and make you wrong or judge you or anything. I'll say, well, let's fix it, but let's take a moment and step back and let's figure out why. And I would ask you, is this a reoccurring thing? You go, yes, I tend to break a lot of teeth. Well, do you clench your teeth? I don't know if I do. Well, let's do a sleep study. Let's see if you're clenching.
Yes.
But let's get to the root cause. Or I'm getting cavities on a regular basis, but I don't eat sugar and I'm brushing. Let's look at your diet. That's what's happening. Do you have acid reflux because you have a sleep apnea problem? That can erode the teeth. So you got to look at the whole picture, and that's really what holistic means. Yes. And it can be a little misunderstood from some people because when you say holistic, they're thinking of some mystical thing. You know, we're waving pyramids or crystals or something.
Or a wand.
Or wand. No, it's not. We're not. It's the philosophical aspect of it. And then join with the Western ability to create a healthy mouth with the right technology.
Yes. No, very well said, and totally agree with you. And your practice, your dental practice, obviously helps people from general dentistry, cosmetic dentistry, orthodontics. You offer your state-of-the-art. You have all the latest and greatest in technology and digital x-rays and everything else. But I love the fact that you utilize that holistic approach to your dental practice for the many reasons you just stated. It really, and you customize your treatments with each of your patients. When they come here, they meet you one-on-one, as we touched on in the previous interview as well. So it really is a philosophical approach that many years ago, as a pioneer in this industry, in holistic dentistry for this region, Dr. Sam, you were really light years ahead of many other dental practices that didn't look at a person as a whole, say, 20, 30 years ago.
Yeah, it just wasn't part of the training that we got. Remember, I said you got to kind of reach out once you get out of school. It gives you the licensing to learn more.
That's
and I still remember one of my first partners I had in practice, and we didn't stay partners long because he made a comment to me once. He said, you know, everything that I need to know to practice there, I learned in school. And I'm like, that's not possible. That's not possible. I'm in my 39th year right now, and I'm still learning.
There you go.
There's so much to learn, and it changes. And it's all for one reason, to make our patients healthier.
That's right.
So whether it's through education or through understanding the holistic approach, and looking at what can we provide for that patient to give them long-term optimal oral health, which then equates to long-term optimal health overall.
Yes, indeed. We're now going to hear from a patient of Dr. Sam.
Well, before I was treated for my dental cavitations, I was having some pretty severe adrenal fatigue, and I also was underweight and unable to gain weight. And I was seeing a functional medicine doctor, and he was able to do quite a lot to help me, but we both knew that there was a piece of the puzzle that was missing and that more needed to be done. So that's when I read online about dental cavitations, and I contacted the Julian Center, and they were able to get me in very quickly for an evaluation, and they determined that I had ischemic bone disease in all 3 sites where my wisdom teeth were extracted as a teenager. So I had surgery on my largest dental cavitation, and afterwards I slowly began to recover, and I'm healthier than I have been in years. My adrenal fatigue symptoms have improved dramatically, and I was able to gain 5 pounds and keep on that weight. And I just have more energy than I have in years. In fact, I even signed up for an adult dance class, a tap class, and this is the first time I've been able to do that in a long time. I was just so excited to see that we had found the problem that had been keeping me sick for so long. And I'm happy, my husband is happy, everybody's happier now that I have more energy and I feel so much better. Well, the staff at the Julian Center are fantastic. They really care about the individual needs of each patient that comes in here. And they understand what I'm sensitive to, and they are very careful to make sure that they consider that every time I come in. And I can tell that the staff here just really genuinely wants me to get better. I would just strongly recommend to anybody that has chronic health issues that they consider whether dental issues could be part of it. Functional medicine doctors and naturopaths and all of those natural health practitioners are a wonderful resource, but they're not dentists, and you really need to have a biological dentist on your side if you're dealing with chronic health issues. I would absolutely recommend them to others. In fact, I already have recommended the Julian Center to friends and family.
We're now back with Dr. Sam. I must say, some great work, doctor, great results.
Thank you for that compliment.
Okay.
But it's really what we're here for. I mean, doctor means teacher.
Yes.
So we have to first remember that our primary reason to be here is to educate our patients, inform our patients. This is a problem I see, that our patients are, well, I'll take that back. Nowadays they're very informed because we have social media, we have the internet, but when I was first in practice, they didn't have access to that.
Yeah.
So, but even so, they may go to a lot of doctors who aren't giving them all the information they need so they can make an educated, informed consent and the decision. They should be the decision maker in what treatment is moving forward. Now, I may initiate my recommendation based on what their goals are.
Yes.
If your goal is for optimum oral health and optimal health, you're in the right place. If you're looking for sort of a fix-it, you know, and that's all you want, we can do that, but that's not what our philosophy is.
Yeah.
We want to prevent, let's say, let's put the dentists out of business.
Yeah.
How do we do that? Prevention and providing the highest quality of care.
That's right.
And having patients and teaching them to be accountable and responsible for their health. And if they can do that, that will change the whole climate in the healthcare field, not just in dentistry, but in general.
Yes. Well, on that note, we'd like to thank you, Dr. Sam, for again enlightening us, educating us, and being our guest on our program. It was a pleasure having you on again with us.
Thank you so much for this time and giving me the opportunity.
Thank you.
Yeah.